Hello, I'm Dr. David Barad, and I'm here with my colleague, Dr. Norbert Gleicher, who is the medical director of the Center for Human Reproduction and the chief science officer. I am the director of assisted reproductive technology here at CHR, and we wanted to talk to you a little bit about PCOS and the effects of exercise on PCOS and fertility. It's interesting because for a long time, PCOS was regarded purely as a fertility matter. We talked about people who had a little extra hair growth and irregular cycles and infertility, and that was what PCOS was. And then acne, yeah. And then about, 25, 30 years ago, people started, being more aware of the so-called metabolic syndrome, which ties in insulin resistance to this whole androgen.
Insulin resistance, cardiac disease, hypertension, to certain forms of PCOS.
Yeah. And so the question becomes, what can one do in terms of lifestyle that might affect these factors?
Yeah. And it is important to reemphasize here that PCOS is not one disease. That's why it's called the syndrome.
It's a syndrome, yeah.
It's basically the bunching together of several conditions because of common denominators. And there's not even agreement how many conditions there are. There are the longest classification believes that there are 4 conditions, A, B, C, D. Others believe there are 3. Most recent research by our colleagues down the block at Mount Sinai and by us on the clinical side suggests that there may be only 2. But whatever it is, it's important to make the point that PCOS is not one disease. And it is important because even though there are common denominators, there are obviously also diverging issues, and one of them is indeed the risk towards metabolic syndrome, which if we look at the 4 entity classification A, B, C, D is really only associated with A, B, and C. D does not have it. D has its own problems, as we know, but only A, B, and C patients, as they get older, develop the risk of having the metabolic syndrome. So what to do if you're an ABC patient and are at an increased risk for metabolic syndrome?
So the metabolic syndrome is sort of tied to insulin resistance. And steps you can take to improve your insulin resistance include, weight loss, exercise, diet to some extent.
Yep.
And there are, these days, medications that can greatly change insulin resistance.
Absolutely. And we are really at a point where we are taking obesity as a infertility diagnosis.
Sure.
For the longest time, this wasn't practical because it was so difficult to get significant weight loss.
Well, you'd have people come in who might be, 40 BMI or 50 BMI, and people would tell them, well, go home, lose 100 pounds and then come back. And of course, nobody can do that.
Nobody came back. Yeah.
Right, yeah.
Indeed. Just as an anecdote, in my old days, while CHR was still in Chicago, we got a grant, actually a pretty generous grant, to investigate weight loss as a treatment for infertility. And under that grant, we're allowed to get coaches for those obese patients, very frequently couples, because morbid obesity you find very frequently in both partners. Yeah. And so we were allowed to pay for the club membership in the health club. We were allowed to get coaches or trainers for them with the money we were granted. Despite that, we had to abandon the study because we just couldn't get people to lose enough weight within 3 to 6 months, which was the time limit we gave patients during that study protocols. And we, in the end, had to give up on the study. But today, with all the GLP agonist, receptor agonist drugs on the market, you can, in 3 to 6 months, lose significant weight.
That was what was making headlines when the GLP-1 agonists first came out. People were saying they were accidentally getting pregnant because they lost a lot of weight. And
yeah,
of course, you can lose weight through diet. You can lose weight through exercise. All these things can be effective. But the GLP-1 is
clearly the most, so far the most effective treatment. Yeah. And it is important to recognize that it has been known actually for decades. I remember first paper probably 20 plus years ago from Australia that showed that if you lose as little as 15 pounds, that already affects pregnancy chances, both spontaneously and with fertility treatments, because overweight affects both. It affects your spontaneous pregnancy chance, but it also affects your chance with every infertility treatment. Mm-hmm. So you don't have to lose 100 pounds. If you already lose 15, 20, 25 pounds...
It's to say 15 to 20% of weight loss will be enough to change. And probably what that's doing is when you lose that 15 or 20% of your weight, it's your body's readjusting, changing its insulin resistance a bit, and that promotes improved fertility.
Yep. And so weight loss is always good, and by whichever means you can achieve it. It's maybe also worthwhile at this point to note that we, in our monthly newsletter, The Voice, pretty regularly address this issue because it is becoming more and more important. Obesity rates are increasing. And secondly, we can do something about it now. And therefore, this has become a true infertility diagnosis. Obesity is an infertility diagnosis, and not only for women, for men as well.
Mm-hmm. Oh, yeah.
And that means what you eat, how much alcohol you take in, how much you exercise, all of that matters. And if you need help and have questions, you can always reach out to us at the Center for Human Reproduction. Thanks for listening.